Thank you, Mr. Chairman, and thank you and Senator Moran for having such an important hearing. And, we have all the rancor that's going on around here, but this committee really does work in a very, very bipartisan way. And because of that, in the last couple Congresses, we've gotten an awful lot done. We all know that suicide is really complex. It's a complicated crisis. There's no single solution. We also know that if people are in the VA system, they're less likely to commit suicide. Most of the people that are committing suicide are outside of the system. So one of the things that we've worked on, and most of the committee's worked on, is trying to make it such that we could capture those folks that are outside of the system, get them some help in the community, and then ultimately bring them into the VA where they can get even additional help. Mm-hmm. Dr. Miller, I appreciate you highlighting the Staff Sergeant Parker Gordon Fox Suicide Grant Program in your testimony. When we wrote the grant program, we intended to provide federal resources to organizations in the community that coordinate suicide prevention services outside of a clinical setting. Mm-hmm. I have met with many grant recipients and heard incredibly positive feedback on the program. After 1 year of this program being in effect, what are the biggest lessons that you've learned, and have you identified ways to improve for the future? So this has been going on for a while. You've got these grant programs out there. What are you finding with them?
Yeah, I think one thing that we're learning is it's written into the law the importance of screening for risk and ensuring that the services are going to those who are at higher risk. But we're learning as part of that process that one of the many beauties of this grant is the services that a lot of the grantees are providing are what we may call upstream in nature. So it's a bit contradictory for them to be necessarily screening for risk and screening out those who aren't high risk when a lot of the work they're doing is moving upstream before these individuals become high risk. So resolving that, I think, discrepancy, I think, is a challenge for us that we're committed to working with you and this committee together. I think the second thing I would say is we're learning a lot about how to screen for risk in ways when you're not a licensed mental health professional and it just feels out of your normal flow of what you do to pull out a survey, a questionnaire, and say, I have some questions here that I need to ask you. So I think we're taking a close look at the screener tool that we've implemented as part of this and wanting to take a look at, is there a better way to meet the requirements of the screen without necessarily asking grantees to slip into a role that feels very unnatural for them as part of their service.
Yeah, and this follows up on your comments and then comments that Senator Moran had, but it does appear that when you visit with people, that are involved, that there's just something about government that makes things pretty complex. And I'm part of government, I understand that. But, providing increased flexibility in that area and the whole process, I think, would really be helpful. So.
Absolutely. I think I would want that to be an open discussion between us, because how I may define increased flexibility, I may have a blind spot then in terms of what you were intending with the law and the applications of the law. So I think it's really important we continue our open and collaborative dialogue so that we are fully capturing your intentions with the law.
No, I agree. And I think something would be helpful if we could discuss with you, but also get some providers in, to help us realize some of the unintended consequences. We all want the same thing. that maybe, you know, a requirement or whatever just makes it a little bit more difficult. So
Yes.